This has been a great year for reproduction. More of what we've learned in the past year that's going to be in our facts and figures is going to be centered on hypogonadism. So when reproductive hormones are not made sufficiently, and the two big areas here really are menopause and male reproduction. In other areas in reproduction that have been exciting in the past year, again in menopause, we have the first approvals of two non-hormonal alternatives to estrogen to treat menopausal symptoms. Ospemifene has been approved for vaginal dryness and vaginal symptoms, and Paxil or paroxetine has been approved for the treatment of hot flashes in women. We've also looked this year at some conditions such as polycystic ovary syndrome, which affects 5 to 7% of the female population. In a landmark study that was done by the Reproductive Medicine Network and NIH-funded Clinical Trials Network, found pregnancy rates with a new medication, letrozole, to be about 29% compared to 19% when clomiphene, the traditional medication that had been used, was given to women to help them ovulate. So this is a new treatment for women with polycystic ovary syndrome who want to get pregnant, something that's likely to reach into the practice of many physicians. Other conditions that are a little more rare are hypogonadotropic hypogonadism. That occurs in about 1 of every 50,000 women, but we consider this condition as endocrinologists to be very prismatic because it teaches us about how the reproductive axis works. And in women with what we call hypo-hypo, we were learning that there are genetic correlations to how they respond to different treatments. So it's the beginning of personalized medicine in this area. As we learn what the specific genetics are, we may learn better how to treat these women other than the traditional treatment with just GnRH. In areas of disorders of sexual differentiation, we've learned a lot in the past year or two, so Facts and Figures is going to have some more information on that. About 1 in 500 women have what we call XY androgen insensitivity syndrome. They are genetically XY chromosomes, but phenotypically they are female. And in those settings, the psychosexual adjustment of individuals has been looked at, along with women who have congenital absence of a vagina or uterus, which is called Meyer-Rokitansky-Kuster-Hauser syndrome. Both of these conditions, about 1 out of 300 to 1 out of 500 women. So not terribly common, but not terribly rare.